Glaucoma is a sneaky disease that can blind you. Learn these natural remedies to help prevent it. Eye pressure, also known as glaucoma, occurs when the fluid pressure inside the eye rises to a level that can damage the optic nerve, leading to gradual vision loss. Sometimes referred to as ocular hypertension, glaucoma is especially dangerous for older individuals. Globally, more than 7 million people have lost their vision due to glaucoma. A defining characteristic of glaucoma is its lack of symptoms until severe irreversible vision loss has occurred in most patients. Therefore, everyone over the age of 45 should have an annual eye exam, which should not only include measuring eye pressure but also OCT scan to check nerve cell health. Before we discuss natural ways to prevent glaucoma or slow its progression if you already have it, we'd like to issue a critical warning. Warning: the most commonly used method for measuring eye pressure is the air puff test, which blows a small puff of air into the eye. While convenient, this is primarily a screening tool. The primary tool for diagnosing and monitoring glaucoma is the applanation tonometer, which uses blue light after an eye drop is applied. This device provides the most accurate eye pressure readings with a much lower error margin than the air puff device. Many patients have been unnecessarily diagnosed with glaucoma and prescribed medications with side effects due to high readings from the air puff device alone. Thus, we emphasize that you should rely on measurements done with the applanation tonometer using blue light. Now let's move on to the natural methods you can try to protect yourself from this insidious disease, or if you already have it, to slow its progression. 1. Walk 5,000 steps a day. Researchers using US National Survey data found that physically active individuals who exercise regularly are 73% less likely to develop glaucoma compared to those who don't. This statistic is remarkably high. Doctors emphasize that while exercise is beneficial, certain types like weightlifting or exercises that position the head below the heart may increase intraocular pressure and should be avoided. For instance, yoga poses like the downward dog are not recommended. However, a moderate-paced walk increases blood circulation throughout the body and provides significant benefits for eye health. A 45-minute moderate-paced walk not only supports overall health, but also helps reduce eye pressure, making it one of the safest and most effective forms of exercise to prevent or slow the progression of this dangerous disease. 2. Lose weight and lower your blood sugar levels. If you're overweight, it's essential to shed some pounds for the sake of your eye health. Scientific evidence suggests that individuals who are overweight or obese may experience higher intraocular pressure. Moreover, excess weight often correlates with elevated blood sugar levels and an increased risk of type 2 diabetes. High blood sugar levels can lead to changes in blood vessels, which can disrupt blood flow in the eyes. Reduced blood flow to the optic nerve can cause damage, significantly increasing glaucoma risk. Accumulated body fat can also reduce fluid flow within the eye, leading to elevated eye pressure. 3. Avoid lifting weights and holding your breath. If you already have high eye pressure, it's essential to avoid two things: lifting weights and holding your breath. The Valsalva maneuver, which involves closing the windpipe and increasing pressure in the abdomen and chest, can naturally occur during certain activities like coughing, straining, heavy lifting, playing wind instruments, or vomiting. This breath-holding action can increase intraocular pressure, so be mindful of this reflex to hold your breath while lifting heavy objects. Similarly, intense coughing or straining can have the same effect. Sleep apnea should also be addressed, as this condition causes repeated interruptions in breathing during sleep, leading to reduced oxygen levels, including in the brain and eyes. Since the optic nerve is sensitive to oxygen deprivation, this can increase the risk of glaucoma development. 4. Eat plenty of arugula and spinach. Arugula and spinach are widely available and beloved vegetables rich in nitrates. In the body, nitrates convert into nitric oxide, a compound that helps relax the lining of blood vessels, allowing them to better handle blood flow and stress. This process has been scientifically shown to positively impact the drainage channels and intraocular pressure in the eyes. Chewing these vegetables thoroughly enhances nitrate absorption, so it's recommended to eat them at least 3 times a week, well chewed and ideally raw. 5. Pay attention to your sleeping position. The position of your head and eyes during sleep can affect eye pressure and increase the strain on the optic nerve for those at risk of or diagnosed with glaucoma. Side sleeping, particularly if one eye remains on the lower side consistently, can elevate intraocular pressure. Studies indicate that the eye closer to the pillow may have higher intraocular pressure due to either pressure from the pillow or altered blood flow. This pressure increase can raise the risk of optic nerve damage, especially if that eye is already at risk for glaucoma. Therefore, avoid sleeping on the side with the higher risk eye. The optimal position is to sleep on your back with your head elevated above the heart level, for which a higher pillow is recommended. 6. Take a ginkgo biloba supplement. Ginkgo biloba offers numerous benefits, especially for eye health. One of its key advantages is reducing free radical damage, which has been shown to slow vision loss and improve visual function in patients with normal tension glaucoma. While it doesn't lower eye pressure, studies have found that it can prevent or at least slow down vision loss, which is a very promising outcome. For short-term effects, taking 80 mg of ginkgo biloba twice daily for 4 weeks has been shown to improve blood flow around the optic nerve. In another study, 40 mg taken 3 times daily for 4 weeks helped maintain the visual field in patients with normal tension glaucoma, even without affecting eye pressure. Always consult your doctor before taking ginkgo biloba, as it may increase bleeding risk, especially for people who use blood thinners. 7. Add the miracle herb saffron to your meals. Saffron is renowned for its health benefits and is considered miraculous in supporting wellness. Elevated intraocular pressure in glaucoma can lead to inflammation of the retinal ganglion cells or optic nerve cells. Studies have shown that saffron can help protect these cells by reducing neuroinflammation. Saffron may also minimize cellular damage within the eyes and has been found to lower eye pressure. A small study observed a significant reduction in eye pressure with a daily dose of 30 mg of saffron extract. You can incorporate saffron into your meals or take it as a supplement, but as always, consult a doctor beforehand to avoid adverse interactions with medications. 8. Include turmeric in your daily diet. The active compound in turmeric, curcumin, boasts powerful antioxidant and anti-inflammatory properties, which have been shown positive effects in slowing glaucoma progression and supporting eye health. Curcumin's anti-inflammatory qualities help protect optic nerve cells by reducing inflammation in the eye, potentially easing pressure on the optic nerve and slowing nerve damage. Since curcumin is challenging for the body to absorb, pairing turmeric with black pepper, which contains piperine, can boost curcumin absorption and increase its beneficial effects. 9. Eat goji berries, also known as wolfberries. Wolfberries or goji berries are a traditional Chinese medicinal fruit noted for their antioxidant-rich Lycium barbarum polysaccharides, LBP. These hardy berries may be native to Asia, however, they can grow easily across various climates. Studies suggest that consuming goji berries can protect crucial eye cells and preserve vision in glaucoma patients. The high levels of zeaxanthin and lutein in goji berries help protect the eyes from cellular damage. You can enjoy goji berries fresh, dried, added to dishes or brewed as tea. 10. Check your B12 levels and supplement if necessary. Vitamin B12 is critical for the nervous system's healthy functioning. Since glaucoma damages the optic nerve due to increased intraocular pressure, B12 helps protect these nerve cells and support optic nerve health. Studies also suggest that high homocysteine levels can increase glaucoma risk, and B12 can help reduce these levels. B12 deficiency can lead to optic neuron damage, so ensuring adequate B12 intake is essential for maintaining these cells. Consider getting your B12 levels checked periodically, and if deficient, taking a supplement in the methylcobalamin form is recommended, and it has shown protective effects against visual field loss in patients with normal tension glaucoma. 11. Consider B3 vitamin supplementation. Vitamin B3, especially in the form of nicotinamide, is being studied as a potential support in glaucoma treatment. Clinical studies have shown that high-dose B3 supplementation can protect optic nerve cells in glaucoma patients, potentially enhancing visual function. B3 supports energy production in retinal and optic nerve cells, which may help prevent damage to these cells. According to Dr. Flora Hui of the Centre for Eye Research Australia, B3 functions like adding oil to a car's engine, helping cells affected by glaucoma work better and resist damage. If you're considering adding B3 to your glaucoma treatment, consult your doctor to discuss integrating it into your current regimen. If you want to be informed about the latest videos in our channel, please subscribe and click on the bell icon. In this way, you'll be notified whenever we upload new content. Have a healthy and pleasant day.